Hello, everyone, and welcome to Arthritis at Home. My name is Ellen, and I'm the programs coordinator. Today, we are joined by Dr. Brett Thombs, who is a professor in the Faculty of Medicine at McGill University, a senior investigator at the Lady Davis Institute for Medical Research at the Jewish General Hospital, chair of the Canadian Task Force on Preventive Healthcare, and director of the Scleroderma Patient-Centered Intervention Network, SPIN. So those are just some of the hats that you wear. And recently, your team was successful in obtaining the Ignite Innovation Grant from the Arthritis Society for your project titled A Scleroderma Patient-Centered Intervention Network Patient Research Partnership for Understanding Pain Sources, Patterns, and Barriers to Effective Management. So I know that sounds wordy, but we're going to break it down for our audience. And with that, Dr. Thombs, thank you so much for spending some time with us.
Well, I'm really happy to be here. Thanks to you for the invitation.
Absolutely. Dr. Thombs, can you tell us a little bit about yourself and how you're involved in rheumatology?
Sure. I mean, I work specifically with people with systemic sclerosis or scleroderma, which people out there might know. It means hard skin in Greek. So it's a autoimmune process in which affects the connective tissues and internal organs, but also, of course, the skin, which is where the name is from. And I got involved way back, actually, serendipitously. I worked in a burn center at Johns Hopkins when I was a postdoctoral fellow, and people with burn injuries actually face some of the same challenges as people with scleroderma, and the skin ramifications and appearance changes, pain and itch. And so someone asked at some point if I would be interested in working with a group that was then, the Canadian Scleroderma Research Group, and it was, in fact. And so I've been involved in the scleroderma since about 2007. About a year after I got to McGill, to Canada. And, a couple of years into that, there was very little done at that point in things that were important to patients. It was very new. And, we pulled together some people, probably about 3 people had written on anything that, what we call now patient important outcomes, things that, affect people on a daily basis. And we all came together and we began to document all the things that challenges that people are facing. And, we fortunately were already working with people living with scleroderma at that point, and decided that we should do something about it. So we brought together about 20 or 25 people with scleroderma and researchers and healthcare providers, and we formed something called, again, the SPIN, now the Scleroderma Patient-Centered Intervention Network, with the idea that it's a rare disease. So if you do things at one center, there's not many people, and they have other things that they have to be doing. So if we all work together, we could begin to do the first large-scale research on things that are important to patients in a rare disease like this. So now 10 years later, we have people that sign up for a cohort we have, where we collect data routinely from 2,000 people with scleroderma from, I think, 50 centers in 7 countries. And more importantly, we do a couple things. We identify things that are really important to people living with the disease. We try to research them and understand them better, and then we try to put together tools and programs. We test them in trials, and we work with patient organizations to deliver those. But I think one of the most important things that happens is that, we're a jointly patient researcher governed group. So our steering committee and the group that sets our priorities, decides what funding we're going to seek and what projects we're going to do, is made up by a group that's just about half people with scleroderma. So about 6 or 7 people with scleroderma. And then every time we start a new project, like the pain project you're talking about, we identify a different group of people that really work specifically on that project. So we have our steering committee are kind of expert people at this point. They've been involved in this, and they know the game. And we try to bring together people with different lived experiences and different diversities that can help us understand the problems we're looking at, and make sure we get it as best as possible in a way that addresses it and resonates with people's experiences.
Yeah, and I'm just, the fact that so this unfortunately in research in health, for everyone who's listening, when you have a rare condition, it's really hard to study. So, your team, what they did was you pooled the data from 50 different centers, right? or so,
Mhm.
and you were then able to kind of solve this problem because now you have enough data to study the condition, to move the science forward. So I'm just thinking to myself, like, wow, that is so important, right? Because gathering the data allows us to better understand. And the second point that you mentioned, for everyone who's listening, patient-centered outcomes. So prior to kind of the popularity and the use of this concept, we measured things, right? Like blood levels, what we call serum levels of certain biomarkers, and we use that as an outcome. Did the intervention work?
Yeah.
But we realized that patients, I it doesn't truly matter. And things like pain, I think is one of the most highly valued patient-centered outcomes, that you're working with patients, you're asking them what matters to them in terms of, you know, what are you improved?
Yep.
Well, that depends on their pain, right? Is that improved? So I think, just really recognizing how much innovation you've brought to scleroderma, because prior to, the push from yourself and the team, it was a condition that was rare. We couldn't collect enough data and we didn't know. So very, very exciting.
Well, we were actually, I mean, very fortunate too, because it is really a community. And, and I think it's not all rare diseases, but in some of them, there is a real sense of community here. And people with the disease, they come together, they have, there's meetings nationally, but they're very, easy and eager to engage and do research. So I think it's not as if we've gone in and started something. We were very fortunate that there was a need there, and there's a community, and we've partnered with them, and they've been tremendous partners throughout the years too. So it's not like we started that part of it. Yeah.
Well, for anyone who's listening who has taken part in research, who has, been eager, who has shared your data, you make this possible, right? And I think you
Exactly.
have a very great point. I'm going to touch on something that you said earlier about how you had patients involved on your team, some patient researchers. Can I ask, what is their role on the research team?
Okay, so yeah, so I think you also again, there's a couple of them. So we started back, when we started, we had a steering committee for the whole spin endeavor, because the spin has sites and recruitment and projects, and we run trials of different programs, and then actually after we run the trials, we work with the patient groups to keep providing them. Like we've trained something like 250 support group leaders now. First we did a trial, and then but now we keep training people. We work with them, so that's ongoing. So there's a lot going on. But we had, a steering committee, which were scientists and healthcare, and we had a patient advisory committee oversight. But we realized at some point that there was no reason to have those separate, so we brought those together. And now we have, people with scleroderma on the steering committee. So there's different roles. So that role is really kind of it's a big picture, where visionary kind of role. Like what should our group be doing long term to address the needs of the different people living with scleroderma? But then there's other ways to get involved too. So we routinely have we've gone out with questionnaires and focus groups, trying to ask people what we should be studying. So if you keep your eye out and look for those, that's an easy way to get involved, without a lot of time. But then you talked about patient researchers. So that a good example of that is a pain project we're talking about. So I mean, that really involves ongoing partnership and consultation throughout a particular project. So what we do with that is when we've identified something, prioritize it, and going out to do it, we have a list. We've actually gone out and asked for volunteers across the world. Would you be interested in being a patient partner, and explain what that is? And you can prioritize different topics you might be interested in doing. And then we try as best as we can to identify, diverse people with diverse experiences in any way. It could be, where they live, their sex or gender, identity. It could be their race or ethnicity. It could be often level of disability and how the disease affects them. We try to get a diverse group of people, and it's in some ways it's fairly straightforward. So people come together. We always meet with this group at the beginning. And we're starting with a point that there's a problem we've identified that's been prioritized. And there's been some questions that have been brought to us, and we bring it to the group, and we have a group discussion with the group of people. What should the questions be that we should be asking? How should we be asking? How should we define what we're measuring? And pain was a great example, because pain's really complicated. In arthritis, isn't nothing so simple, but mainly you have inflammation in joints, causing pain. But in scleroderma, you have inflammation in joints, you have skin hardening and ulcering, you have changes to your mouth and dental areas, and dryness that can be very painful. You have really big effects on the gastrointestinal system that can be painful. The contractures, and they can go on. There's many different things. And so what we're basically working with this group was trying to figure out what should we be looking at, and what should we know about it? What are the experiences people have with pain? It's to say you have pain isn't necessarily very helpful. But so that group really, in a way, defined what went into this grant you talked about. So we have a proposal for a grant, and they defined it. Well, we need to be going out and asking people which of these different aspects are happening, and ask them how often they're happening. Ask them what kind of pain it is. Ask them what things they're doing that make it worse or better. So that group of people with scleroderma really kind of laid out a template for us of what we should be looking at. What usually happens then is that we have people with research expertise on our team kind of put those in research teams and frameworks and measures, and then it's a conversation. So we go back and say, this is kind of how we're defining this, and what it means. Does this match what you're getting at? Have we gotten this right, or where haven't we gotten it right? And then we have that conversation. We adapt it again, and so so there's something they're involved all the way across the process. We we go out and collect data, we report back on what's happening. If we're having difficulty with finding people, certain kinds of people, something, we ask the group, and we get feedback from them there. And of course, at the end of the process, we get input on what it all means. So we share what we're finding. People with scleroderma tell us what they think it means, and we incorporate that. We write it up, and we all author it together. So you'll see that people with scleroderma are co-authors on all of our publications, and so it's I think it works really well, and I think it helps us get research never measures anyone's experience exactly. And as soon as you collect data or flip a coin in a trial to see what group someone gets, you're moving away from real experience. But it helps us get a lot closer, I think, a lot closer. I know we get a lot closer than we would otherwise.
Yeah, that's so well said, because I think what you've done is you've brought and you've highlighted and you've emphasized the patient voice in all of this, right? So you went to the people that your research aims to serve, patients. You not only involve them in generating the question, but also at the steering level, right? So the steering committee level, which is the decision makers, right? They help to make those key decisions, and they are, like you said, visionaries. I love that term. They are the visionaries for the long term of this project. And then you have, them decide, okay, or patient researchers engaged to help decide, okay, what specifically are we going to do? What is that specific question? What are we measuring? Those patient-centered outcomes, right? So having the research is integrated, right, with patient voices at every single step. And like you said, what it does is it allows the research to get a little, maybe moderately closer to reflecting the real world, to be able to be effective in the real world, which is so exciting. And can I ask, from your own personal perspective, what have you perhaps learned from incorporating the patient voice, or what have you seen the benefits of incorporating that patient voice?
In one way, I think that's not even learning. I've made many good friends at this point. So it's made, I think for me, it's made the research more real. And I think for others, I think there's a huge problem in academic research about waste. So much of what we produce, no one will ever use. No one, it's not going to go anywhere. We publish on it, we get grants, we get lists in our CVs. And I think that, having people involved who are living with the disease, who then you have actually, whether they're new and you're building a relationship with them, or you have a relationship with them, that it really kind of reminds us on a day-to-day basis that if we're going to do something, that means we're not doing something else. And how is what we're going to do going to be useful? And does it matter to people who are giving their time, who are donating money to their organizations that sometimes comes to us, or through the Arthritis Society in the case of the grant you mentioned, right? And or just paying their taxes so that we can do things that are useful. So are we doing things that are really useful? And I don't know, I've learned just how miraculous I think people are, because some of the people we work with, the things they're doing with the challenge they face are incredibly motivating, and it puts things in perspective. Like sometimes I think you can't do something, you can remember some of the things that they're doing and some of the things they're achieving, despite huge barriers. And I think it's really very inspirational in that way, too, to put in our life. So I don't know if that answers the question, but I think it's just a really it's a win-win for everybody involved, I think. And if you're out there and you don't need the skills that you need to do this, you need to be share your experiences basically, and be comfortable telling us when we haven't captured those experiences, right? They're fairly basic. And when we put together groups of patients, we try to get a diverse group, but we also try to have people who've done, a couple of them done this before, who model that it's okay to do this, and we really listen. And yeah, that's it. That's all it takes, though.
Yeah, absolutely. And I do want to emphasize that to patients, where if you are interested in getting involved in research, number one, there's different ways you can get involved, right? If you don't want to be designing the intervention, you want to just be, naming things that are priorities to you, there's a way to do that. If you want to be contributing your data, there's a way to do that. If you do want to be like part of the visionary team, the long term, right, to foresee the long term of the intervention, there's ways to do that. So it is up to you. And as Dr. Kuntz had said, there's also this, I think, thought that perhaps there needs to be training, or, you have to have so many years doing this. And it's no, like, you will learn, right? You learn while you're there, and to develop those skills slowly. And there's a team to support you as long as you have something to say, right? We do, as researchers, I think the paradigm has really shifted, right? We understand that knowledge now is not only the data that we generate, but the experiential knowledge of individuals will help to drive the data or the research forward.
Yeah, and sometimes the contributions can be seem fairly straightforward for people with scleroderma that end up being huge. So just to give an example, at the beginning of the pandemic, since we have this infrastructure of lots of people, that are associated, we have people who have trained to lead support groups. We very quickly put together a mental health intervention to help support people. It was 3 times a week. It was a partnership between trained support group leaders and mental health professionals. And we want, when you do a trial, you have to decide, what is it you're going to target? What's the most important thing, and what are you going to measure? And everyone was talking about depression and loneliness and isolation, if you remember back at the beginning. And our patient panel came and said, no, with scleroderma, we're used to those kind of things. And this is not everybody, but it's everyone's scared. It's anxiety. Everyone's, we have an autoimmune disease. There's this bug floating around out there. You need to be targeting anxiety. And so we set up our intervention around that, and we developed our intervention around that. And then separately, we were actually collecting data from people in mental health. And what do you know? Compared to before the pandemic, depression didn't change at all. Anxiety went way up. So they were dead on without even seeing any data. And thankfully, so that sounds like a little thing, they told us what they were living and what people they knew they were living. And we could have missed the entire boat on putting together a trial that targeted the wrong thing, and didn't address people's needs, and wouldn't have been successful. But just with that, that's just one example of that input. We got things a lot more right than we would have.
What a powerful story, right? It was one comment that changed the entire trajectory of that research for the better. So if you're a patient, you're listening right now, like, your contributions matter. They absolutely do. They can help to shape research. They can help to drive research. And we, as researchers, we want to listen. So please, with that, Dr. Thombs, do you have any ways people, individuals, caregivers, anyone can get involved? We can obviously link resources as well.
Yeah, well, for our group, if you just go to spinsclero.com, that's our website. There's places there you can see, and you can just drop us a note, and we'd love to involve you. I think there's definitely other places. I know out in British Columbia where you are, the Arthritis Research Center must have place to get involved in other areas of rheumatic diseases too. So you might be able to speak to that.
Yeah, absolutely. So we'll definitely link a few resources if you are interested in being involved in research and getting to know what it's all about. And we will definitely provide that.
Great.
With that, do you have any last insights or more stories to share to help a patient on their journey?
I don't know. I mean, I think that I think just getting involved. Everyone does it in their own way. We have wonderful, at least I know in Scleroderma, we have wonderful organizations in each of the provinces that are out there to support people with scleroderma. There's a national organization, and the people that are leading these groups are really wonderful and caring people. And you do it. You can go there and look at their website and get information. You can show up at a meeting. There's support groups, and support groups aren't just for people who need support. It's also a good way for people who are coping pretty well to share that with others. How they're doing it and support others too. So I think that and again, I'm not someone who's living with rheumatic disease, but just from my take on what I understand from people who are that, get involved and get to know others with the disease. It's a tremendous group out there, and people are doing all sorts of good things to help each other. And so that's out there for you.
Wonderful. Dr. Thombs, thank you so much for your time. Thank you for sharing, your stories as well as some inspiration for myself as a researcher. So with that, to our audience, thank you so much for joining us on this episode of Arthritis at Home, and we hope to see you soon.
Well, thanks to you for doing this. It's really been a nice experience, and thanks for organizing all of this.
Absolutely. With that, take care to everyone. Goodbye for now.
All right, bye-bye.